Welcome back to the Physio Foundations podcast, where we talk about the knowledge and skills that provide the foundation of expert clinical practice. So it's been a while, as you might know, if you follow the podcast. Things have been really busy on the home front for me. I've got Susanna, my wife, who you know from the podcast, co-host, writing up her PhD at the moment, which is a really busy time in anyone's life. And on the work front, I've got my own work cut out for me coordinating the first year Bachelor Physiotherapy students here at Monash Physio. So, and there's also research and lots of other projects. So full of excuses. It's good to be busy, but it's also good to be back. And I've really been looking forward to this episode for a number of weeks now since we set it up. So Jordan Rutherford has been a physio since 2016, and he's now the founding director of the Launch Health Group here in Melbourne, Australia. Jordan's one of our teaching staff in Monash University Physiotherapy. He works with me and the team in the first year of the undergraduate program. So he's teaching musculoskeletal clinical skills to our first year undergraduate students. And he's also a physio. And he works with the Professional Golf Association. I hope I've got the PGA abbreviation right, Jordy. Yeah. And so he's a busy guy. He's got a lot of diverse interests. I'm going to talk to him in this episode about his teaching and his clinical interests and how they've come together and what's led him towards teaching with us. He's got a lot of interesting points we're going to be able to dive into. So Jordan Rutherford, welcome to Physio Foundations at last.
Thank you very much.
Yeah, it's good to have you here. So let's go into it. Let's talk about you and your clinical interests. It is the Professional Golf Association, right?
PGA. Yeah. So the PGA is the body for professional golf. There's a number of PGAs. So PGA of Australasia is the one I work with. So the PGA Tour of Australasia. And get to travel around a little bit and be exposed to elite sport that's maybe a little bit different to your footy and your soccer and basketball and that sort of thing.
And that's why I want to talk to you about it. And there'll be people listening here who are interested in all the different pathways they can take in their career and what they can do. And they'll be very interested to see how you got there and what you do. And so we'll talk about that a bit more in the second part of our conversation. So in this first part, we're going to talk about you and your training and your interests, and then how you teach, your approach to teaching, we're going to reflect on your first 12 months of teaching with us.
So we've been doing the CBLs last year. So I've been doing the case-based learning for 2 years. And then this year, the first year of doing both CBLs and practical. Yeah. Yeah.
So the clinical skills that we teach, and we call them the practical, or the prac classes, and the case-based learning, where we sit in the tutorial room and break the case apart and really focus on broad knowledge and clinical reasoning. So let's go back a step before we talk about that, though. Tell us about you, your training, your clinical interests. So 2016, you graduated from Monash with us. I do remember clearly you as a student. And I remember you mucking around one day and I had to tell you off. It's pretty funny to be sitting here now in the position we're in.
I think that wouldn't have been too uncommon back in my undergraduate days. That'd be fun.
13 years ago. It's a long time at that stage of life, for sure. So, so tell us about where you came from, how you got to where you are now.
So I always knew I wanted to be a physio, and I won't get too stuck into the weeds about that. I mean, we can chat about that maybe when it comes to the golf stuff. But so, I went through and started in 2013, graduated in 2016, and started a job in private practice that I'd done as a clinical placement. So I worked with Andrew Dalwood, who's a specialist musculoskeletal physio, and he was a good mentor to get my private practice journey started. So that's sort of what I did straight out of uni. Worked with Andrew for a few years. I did a couple of months after graduating at Don Vale Rehab, so a little bit of outpatient work as well, and some weekends and things in the middle, which, as a first year out student, always working a bit too hard and doing too many weekends and trying to burn yourself out too quickly, but did a bit of that. And then an opportunity came up at the PGA. I got a little bit lucky timing wise, but I think, luck only plays a certain part of that role. putting yourself in a position where when that opportunity comes up that you're the right person for the job also plays a big role. So I got a little lucky that the timing was right when I jumped on Seek and had a look for different jobs, and this one came up, which was right up my wheelhouse. And so I went for the job and managed to get that. So I started that in 2019, working as a contractor here at the PGA at Sandhurst. And essentially, so I was a contractor, so it was sort of my own business, working alongside golf coaches and in their learning and performance centre. And then started Launch Health Group in 2022. So it's been a journey across the last sort of 4 years, and it's a little bit different now, but a lot more time consuming.
There'll be many who are in private practice, thinking about going into private practice as a student, who'll be really interested, and myself included. I'm very interested in your story of how you did that. How do you? That's a big undertaking, but well, let's do that now. So let's talk about, you're the founding director. You're the director of this successful private practice. I mean, that's a lot of work. How do you fit that in with clinical care, with teaching, with this podcast? How do you fit it all in? And let's go back to how it all started.
Yeah, I'm not sure how I fit it all in, to be honest. And
you've got a newborn as well.
I do. I've got a 3-month-old at home, so that's put an extra spinning plate into the mix. So I'm trying to keep them all going.
That's life. Yeah,
absolutely. It felt like a fairly natural progression going from a contractor role into having a bigger space and employing people. That wasn't it was a big step, but it was a bit of a natural progression, as opposed to going from an employee somewhere else to then starting your own practice from scratch, which is essentially what I did in 2019 as a contractor, but in a maybe a bit more supported setting. So that happened last year after a fair bit of chatting to the PGA about getting a bit more space, and I felt like there was a certain point where my caseload had kind of maxed out a little bit, and just as a sole practitioner there, with one room, there wasn't much more I could do with the space. And so then I started chatting to them about, is there any way we can expand this and I can have some more space and get a few more rooms and then build on that. And so that's what happened. So yeah.
Is that more luck and timing, as you mentioned before, as well? Or is it just sort of a natural progression of what you're doing?
Yeah, a natural progression, a little bit of risk. I mean, I could have probably just, been happy with what I had and just with a single room and just doing my own stuff, and it would be far more low maintenance than what I'm doing at the moment. But I guess the goal was always to try and see what I can do private practice wise and expand and build on that. And that's probably one of the things I do find that I enjoy is, for work in general, not necessarily just in physio, but trying to build something. And, I think in private practice, it can get a little bit, you just see patients and hopefully you fix them. And in a sense, you get a bit of a reputation and that you build that, but at the same time, you're always sort of working for someone else's business and you're building their business. So for me, it was nice to have something that I could show that was mine, and your hard work is sort of paying off and building something. So that was the motivation for me. Yeah.
What are the pros and cons of working for someone versus working for yourself? So we touched on the autonomy and building something there and being independent. Mm-hmm. What are the advantages of working for someone? I think I'm talking to our students and new grads here who are thinking about their first private practice role, or anyone.
Yeah, I certainly think as a new grad, I would not suggest working for yourself as a new grad. I think the support and having other people around you is really important early on in your career, particularly, but it can be, it's important later in your career. And we'll touch on that, I'm sure, with the teaching stuff of having other physios around, where normally, in my business, that's not the case. So having that support around is really important. Time, if you're working for someone else, you clock off at the end of the day, you don't take your work home with you generally. And there's less responsibility. So that's definitely a pro.
Financial as well. You're
Yeah,
sort of
it's more
covering the
secure.
financials in your arrangements, your percentage, for example, of what you're being paid, and that's paying for a lot of stuff and that you don't have to think about.
Exactly. Yeah, you got a guaranteed salary most of the time, depending on your arrangement, and working for yourself, you definitely don't. Like if I go away for holidays, it definitely is more of a consideration of how long to go for, not just annual leave. I don't have any annual leave or sick leave or anything like that as the boss, but yeah, you have to consider all that stuff, and it's harder to make that happen where, maybe if you're working for someone else and you got annual leave and you book a holiday and you know that you're going to get 4 weeks every year and you can plan that stuff ahead, and it's a bit more difficult working for yourself for sure.
These are the factors you need to consider, and people contemplating these pathways will be considering. So that's really useful. And on top of all that, you supervise students.
Yeah. I started doing that at under Andrew at Waverley Park, and I really enjoyed having a student, sit in and watch what I'm doing, and they'd quiz me, and it'd keep me on my toes, and I'd have to have an answer for them. Or, sometimes it's absolutely okay to say, no, I don't have that answer, but try not to do that in front of the patient too much. But yeah, they kept me on my toes, and I could sort of review a little bit of my own learning by, helping go through subjective interview stuff and clinical reasoning, and much like what we're doing with teaching anyway, but you're sort of doing that in a different setting. And so I really enjoyed that under Andrew at Waverley Park. And then just sort of, as I continued doing stuff through my own business, kept in contact with Monash and said I'd be happy to take students. And so I generally take about one a year. Otherwise, it's a little bit difficult. I'm already a bit busy, but I do definitely enjoy having students come and spend some time with me and help grow their confidence, and obviously keep myself in check a little bit, because I always asking why you're doing these things. And I think in private practice or in any form of physio, you can get a bit stuck in your ways, and if you're not being challenged on things at times, then you might just treat stuff the way you always treat things, which may not always be the best thing. So it's good to have to reason your way through stuff. So I'm doing this because this is the expected result, and then they learn and I learn, and we just keep evolving practice and building the way we do things. Yeah.
So that supervision of students is feeding into your professional development
as
a clinician. But how does it link or help or feed into your university teaching? So is it very different supervising a student compared to the classroom teaching that you do with us?
I think it depends on how you choose to do it in a clinical setting. I know some students will have very varying experiences on placement, particularly in private practice placements. Some will probably just sit in the room and watch people do stuff for 5 weeks straight. So it really depends on what you want. And so in that sense, I try to not treat it too differently, except to give them a bit more autonomy and try to give them opportunities to do things and build their own confidence, and try not to look over their shoulder too much. And so they can just get used to, this is how you work as a private practice physio. Maybe that helps with some fears around, because private practice is a little bit of a sort of unknown setting for many people, and they don't get exposure to it as much as, say, a hospital. So a hospital might be a much more comfortable environment to start out in because of all the core placements. And then private practice, some may never have spent much time in it at all and not done a placement, and therefore it can be a bit scary. So yeah, I try to
at this point
guide them in that direction.
And they'd be lucky to have you, and you'd be, there'd be a lot of fun being on a placement with you as a supervisor, and they'd learn a lot. Charismatic guy, right, and very knowledgeable. What if we sell going straight to private practice?
Okay,
let's just sell that to our grads and students. So the first thing you said about that was the importance of having going in with other people and that mentorship, and we've had lots of previous episodes on that. So tell me about what would you advise a student who is thinking, I'd like to do private practice, and you're trying to push them in that direction?
I'd probably say at the moment, particularly in the job market, if you want a job, you'll find it, first of all. So in a sense, you can be a little bit picky. Maybe when I was coming out or at different times, it's been the other way around. But I think at the moment, private practice or in hospitals and everywhere, they want people to work. And so we're always looking for people. So in a sense, you can kind of pick and choose a little bit and find a place that's going to support your learning and ask those questions and challenge them a little bit around what are they going to help provide. Sometimes you get promised the world and delivered less, but hopefully that's not the case. So I would be asking those questions and say, what sort of professional development do you offer? How are you going to help mentor and shape me in that first year? Because otherwise you do get stuck in the room on your own. And even spend time, honestly, I'd be impressed if someone had booked an appointment with me and came just to see me as a patient, and then I noticed that they'd applied for a job. So you could do things just to see how the clinic works, ask if they would be happy to have you in for the afternoon and say, interested in applying for a job, but I want to see how your clinic works.
I wonder how many students have done that. Good, sprained my ankle. It's not too bad. Don't I reckon book in here into this clinic and get the patient experience there. And
I know certainly a lot of physios that I work with who went through uni with who went on and got jobs at places they were a patient at because they like the way that
perhaps a bit less deliberate than I was implying, but exactly.
Yeah. But they know that they like the way that a physio operates and how the business operates, and that's a good start. So if you do know a little bit about the clinic you're likely to work for, then that can help make sure that it's a good supportive start to your career for sure.
So the main theme there is thinking about the support that you'll need, which you need a lot of, and that's normal as a new grad and going into somewhere where it's a match for you and you feel like you're going to have that support. And that's something we've talked about at length.
Yeah.
So it's good to hear that again. So tell us about now, let's talk about teaching at now undergraduate teaching that you're doing with us. What have you... Let's just sort of reflect on what it's been like, first of all, for the first 2 years for you. And I'm guessing that you're going to do a lot more.
If you'll have me, yeah.
What's it like? And what have you learned? How has it been? And let's reflect a little bit on someone who's been a full-time clinician, very busy and doing a lot of various heavy clinical workload, and then going into a very different environment of classroom teaching. And I really want to think about what you've learned personally, but also what was a bit different from what you expected as the clinician looking in versus someone being there on the classroom floor teaching.
Yeah, I think, well, first of all, I've really enjoyed it. It's been nice to have a bit of a change of scenery from seeing patients and doing clinical work or out in tournaments and that sort of thing to teaching the basics of what we do. So that's been nice. It's a different change of pace. And, I find 18, 19-year-old kids really fun to work with. So it's really different in that sense. You can sort of help almost get alongside first year students and say, guide them in the right direction, and it's a different way of doing physio as opposed to treating patients. So I've definitely enjoyed that. It's been a really good opportunity to go over the basics, anatomy and some physiology stuff, and working alongside people who are in research, so you get exposed to a little bit more of their specialty area, and they bring a lot to the table in terms of this is recent evidence around this stuff, and they're doing a lot of things that maybe I don't have time for. So that's been a real bonus for me, picking up, working with guys like yourself and Pat, who's doing his PhD as well, and Mick, and experienced teachers that, maybe don't do as much clinical work, but have a lot of research knowledge and stuff to offer from the teaching point of view. So I've learned lots from the people I work with. And it's been good to go over, like I said, your anatomy again, and you go, I've got to teach, practical skills around the knee, which I'm confident with. But then, from time to time through your career, spend a lot more time looking at knees, and you forget a little bit about, anatomy of the forearm, for instance, or or vice versa. And so having to go through that anatomy has been a nice way to almost refresh your knowledge each year and go over it all again. So it's never like, while it might be essentially basics, it's foundational, which goes nicely with your podcast, that you need that, and it's never bad. Like, it's never useless knowledge. You need anatomy is always useful. The basics of practical stuff's always useful, and you can't get too much of that. So that's been really nice opportunity to go over all that stuff again.
Oh, it so is. You have to love it. You have to love the learning. And sometimes that takes some time because it's a grind for a lot of students going through the vast amount of content and experience and clinical placements and everything, and being assessed on it the whole time. It's very different when you're not being assessed on it.
Yeah,
and,
absolutely.
And you're coming back with the experience of being in the clinic, and you're really driving yourself into that. You don't have to be there teaching. You can do anything you like, really, in your career.
Yeah, I think it's probably, like I said, that when you're being assessed, or even early on in your career, particularly in private practice, where you might just be feeling like you're treading water a little bit, or just trying to keep your head above water, dealing with the caseload and different things that come through, and trying to, get your head around how things work and what's the best way to treat different things. And maybe a few years down the track, I'm in a more comfortable place to go, all right, well, I'm happy to have a new challenge, and not in each individual consult, I'm not stressing about how I'm going to assess and what's going on, and that gets a little bit easier. And now it's nice to go back and learn more and keep learning, and it's more fun going over things because your brain's not full of stress about how do you deal with patients and managing a caseload, and you're used to all that stuff. So it's nice to go back again.
This is a really nice time of year for us because the structure of, and this will be similar for physio courses around the world, that the structure of the musculoskeletal units is in regions of the body, and you make your way through from the spine and, first of all, the hip and lower limb, and then the spine and upper limb. And you reach a point where, and I say this a lot to our students, well, I really do hope that you feel like there's a lot of repetition here. I hope you feel like on Friday when you come into the prac and we're going to be doing the physical examination of the wrist, which is coming up, and we've done the interview and the surface anatomy, for example. I hope you really feel that you know exactly what we're going to say on Friday when you come in here. What are the physical examination categories, the tests of things you're going to be doing? What are you looking for? What information do you get from that? If there are some diagnostic tests, get some yes/no tests for diagnosis. So what's the expected finding from those? So is it pain? Is it reproduction or is it weakness? Is it instability? And then it's really nice to see the lights coming on and the information that they already know, but they click it all together in their minds. Go, oh, okay. You can see the students sort of comparing what they learned on the shoulder in terms of the structure and function of the shoulder to the hip, which are functionally similar but very, very different in terms of their loading and their injury. And there's so many things that you can help the students, you sort of facilitate them to push them in that direction, to bring it all together. And whereas early on, there's a lot of rote learning and they don't necessarily have the context.
Yeah, I think you make a good point in terms of bringing anatomy, prac skills, physiotherapy, physiology, and putting it all together and say, well, how does it all relate? And that's a nice part of the Monash course, particularly how it's integrated that way. And then maybe it happens in first year, maybe it happens later in your career, but starting to get the idea of do a test or hear something in a subjective interview and ask a question, and what does it actually mean? What are the implications of a positive test or, a 24-hour behavior of symptoms? What do you do with that information? And going beyond, I ask it because I know I have to, or I test it because it's a shoulder test, and refine that to, what information is useful. And if I get a positive test in 10 different things, how do they relate? And that's sort of a skill that I try to help guide students along with in that you do a test because they're shoulder tests and you learn tests, and it's good to do the basics in that scenario or an interview, but then delve a little bit deeper and go, okay, well, if someone told you that they're waking up stiff and sore in the morning, well, what does it mean? What are you going to do about it? And how does that shape what you do with your patient and how you manage them?
Yeah, so good. You did an activity a few weeks ago. Do you want to tell everyone about this activity? It was in the class, and I came in and I just happened to see it. And so it was during an interview, and to achieve exactly what you just said, you had the students do an interview with a mock case and then a partner. Do you want to tell them about that? Patented Jordan Rutherford teaching activity that you did?
Yeah, actually, I find you just, if you get a bit creative with teaching, there's a lot of things that you can do just on the fly. Oh, this is a good idea. We'll give this a crack. I just got them to do an interview, and then I didn't warn them, but at the end of their interview, their body chart and mentioned to whoever was the patient have a specific diagnosis or something in mind that you are trying to act out, and then got them to swap their body charts with someone else in a different group, and they had a couple of minutes to look at a body chart without someone being able to explain it and say, all right, summarize this patient and tell me what you think a diagnosis might be, just to drive home the idea that there's a reason why we take notes, and don't just write stuff down on the page just because it looks pretty. But really someone else needs to be able to pick that up, or you 2 weeks down the track or 4 months down the track or whatever, and pick it up and go, oh, I know enough about this patient to figure out what's going on. So that was a nice little eye opener for some of them, that there were, gaps in in some of the information they were putting down, or maybe they were asking the questions, maybe they weren't, but someone else couldn't pick it up and figure out what was going on. So that maybe they need to work on that a little bit.
Yeah. The problem is the more we use that, well, it's not a problem. The more we use that, the more they'll see it coming, and the more students will probably be prepared and prepare good notes.
That's the hope. Yeah. That's the hope, that they do better notes.
Yeah. So, I mean, this is probably an example of where you've really found your feet with the teaching, where you've got, you've got that knowledge in the clinic, and you've got that real sense of what it's like still to be a student. So you're a bit younger than me. You're maybe the conduit between the middle-aged guy here and there's the coordinator, and you're young and cool, and you're currently working and do fancy things with the PGA and in your clinic, and I'm sure the students love working with you. And so you've got that creative side with teaching that you mentioned, where it's not about you. It's just not about you as the teacher. It's about, we refer to each other as facilitators. In Joe Corbett and the anatomy crew have that on their name badges, facilitators, which is important because you're not there to deliver knowledge to people. That's already there in the passive resources. You're there to teach and educate and to facilitate. So, which is what you were doing there.
Well, I think, firstly you say young and cool, but
did I say that?
I don't feel that way.
You're a dad though, so I can't call you that anymore.
I'm a dad who's I feel a little bit older than the guys and girls we're working with in the course. So they don't make me feel super cool, but it's nice to think that
you've got the balance. But you're a dad now, so
that's right. It's
all
dad
dad
jokes for a long time. Just now I'm qualified.
Yeah. Well, you've got to get ready. You got to prepare. What are the most important foundational knowledge and skills for a physio from all of your experience, from what you've seen in teaching so far?
I have listened to a few of your podcasts, and so I agree with a lot of the responses. I know you ask this fairly often. So
that's my recurring question.
Yeah, I do agree with a lot of the other responses that people talk about, knowledge of anatomy and communication. And initially that's sort of where my mind goes. I think that they're really important, but I thought maybe just as a different way to look at it, maybe more as a quality in a person, or that helps people become a good physio, because you don't graduate at the end of fourth year and all of a sudden you know everything, although you often feel that you do. which we know about the confidence and experience graph. So you might feel like you know a lot, but we know that you're not going to graduate as a super knowledgeable physio. So I think, as a quality, I think humility is a good quality in a physio, in that we don't know everything. There's going to be gaps in our knowledge. And at the end of the day, our role is to help patients get better. And sometimes the best thing you can do is to refer them to someone else. And it takes some humility, I suppose, to know your scope of practice or your scope of expertise. And I know, personally, I found some of the best feedback I've got from patients is when I've said, no, I think I want a second opinion from a different physio who's in women's health or in neuro. And they'll come back and say, no, I really appreciated that. They were great. They had a lot to contribute, and patients do actually appreciate some humility in that. If you try to treat everything and be a bit of a jack of all trades, then often you'll miss things and patients may not get better. So I think humility in that sense, and at the same time, honesty with yourself and patients, again, where your expertise lies. And I think, again, the focus is on the patient. If you want to get them better, and you're honest with them around what you can do to help them and what maybe you can't, around what we know is evidence-based, and not trying to sugarcoat things or convince people that certain treatments are silver bullets, that they'll magically be fixed by stuff. And if you're realistic in that sense, and honest with your patients and yourself, then I think that goes a really long way for both you and them. So I think those two qualities are really important, and probably help around how I like to run my business, but and as a physio, and hopefully as a person too. But I think if you're honest and able to be humble, then you'll get better outcomes for your patients, and also, I think it's a better long-term strategy.
Yeah, and it's like we said about teaching before. It's not actually about you.
Yeah,
it's about the person who's come in seeking healthcare. Ben Meadley talked about that. I think it was Ben on an earlier episode of this podcast, like a hallmark of expertise being the willingness to say, I don't know, and look things up. So he's an expert paramedic. I think he was talking about patient care with students in a more urgent emergency situation, and the ability to slow things down and not try to close it off and pick a winner. So so humility and honesty. We could add integrity to that as well. It sort of goes.
Yeah, integrity was one that I was like, oh, maybe there's three, but maybe they all overlap too much.
Yeah.
But now that you bring it up, I agree.
Sort of related, isn't it?
Yeah.
Yeah, that's a great answer. And I think this is something this is not just for students and new grads. It's for anyone who's interested in these topics in professional and as a health professional, and specifically physio. So it's fantastic. Well, I reckon we're going to save the rest. I have questions, so many questions for you about golf, PGA. I want to talk to you about strength measurement in the clinic, which is something that you and I are bringing into an activity very soon with our undergrad students, and they're introducing to that. That's if you're interested in handheld dynamometers, force plates, and perhaps some of the less common patient presentations and the things that Jordan's done. He's traveled with golf. It's going to be a really interesting chat, but you'll have to hang tight for the next episode. So let's save it for that. But for now, thanks very much, Jordan. Really appreciate you coming on for a chat.
No problem at all. Thanks for having me.
So until next time, this is Jordan Rutherford and Luke Perrotin wishing you all the very best with your studying, professional development, and lifelong learning.